Welcome to the Conscious Giver podcast. I'm Tysis Jackson, your Conscious Giver in Chief. This season, we'll be highlighting the Conscious Giving Guide 2021. And as always, it is packed full of conscious givers, but it's a little different this year. This year, we will be focusing not just on how you can become a conscious giver, but also how you do conscious giving. We want you to be intentional with your giving so you'll make an impact. So this year, we're talking about a specific issue. We're talking about health disparities in rural health. As you may have listened to our earlier podcast, you've learned a little bit about my personal experience in 2021 and how health disparities in rural health really changed my life and encouraged me in a very profound way to start to do conscious giving every single day. And that is the theme of our conscious giving guide, is conscious giving every single day. And I'm really excited to have our first guest. In the midst of caregiving for my mom, she had her pancreatic cancer diagnosis. Dr. Christopher King was a panelist in the program that I was participating in. And in that program, he mentions cancer disparities, and my heart really leaped. Because my mom was battling cancer in a rural part of South Georgia, and it really shook my viewpoint about health disparities and what it was like to be in rural America with a really serious diagnosis. And I saw the stratification of race, geography, what you're insured, and so many others that I can't even list. But I knew that this topic had to be discussed further. And so that very fortunate meeting of hearing Dr. King talk about health disparities and also cancer disparities kind of ticked in the back of my mind. And so I'm so happy to have him a part of the Conscious Giving Guide 2021. He serves as the chair of the Department of Health Systems Administration at Georgetown University. He provides visionary leadership as the department chair. He teaches, he creates curricula, and that's all at the intersection of healthcare, public health, and racial justice. He's also a lecturer on implicit bias and population health management for the Georgetown University School of Medicine. And prior to Georgetown University, he was in healthcare leadership and has a wonderful resume I can't really go on and on about. But I will say this is that the part that he talked about cancer disparities was at the heart of his PhD work in health services administration. It was with a focus on vulnerable population and cancer survivorship. And he did his work at the University of Maryland, College Park. So I want to thank and welcome Dr. King to the Conscious Givers podcast. Welcome.
Thank you so much, Tysis. It's a pleasure to be here.
Well, I'm happy to have you because one of the things that I had a personal experience and my challenge was on my mom's, on just the whole care of my mom. It just wasn't just one thing. It was, as I shared in the earlier podcast, in April 2020, my mom was misdiagnosed with diabetes, which I later learned that's usually is very rare in a 69, 68-year-old to be diagnosed with. But then not shortly after, not even a year later, she, in February of this year, 2021, we actually learned that it was pancreatic cancer and she was stage 4. And I was really angry. I was very, very angry. And so you're going to tell us how to fix it all today. I'm just teasing. I'm not going to tell you how to fix it. But I seriously, I really want people to understand that about that healthcare providers and systems, there's a big difference between it. And you lead the Georgetown Department of Healthcare Systems Administration. And I think it was just important for me to learn, like, what does that mean? And how do we kind of distinguish the care part from the actual systems? Because there's just so many layers.
Wow, that's a great question. And
Sorry
you
to
know, we
like I
could,
hit you hard at the
right,
beginning.
right. It wasn't even a softball question in the beginning. No, this is great. And cancer is a condition that it really does shed light on how complex healthcare is, right? And so when we think about, let's use patients experiencing cancer as an example, it's key that they get the right care in the right place by the right provider, right, at the right time, right? And so when we unpack all that, it's important to note that it takes an ecosystem to make that happen. And that's what we mean by health system. So we need providers and allied health professionals. We need primary care providers, folks who specialize in specialty care, from pediatrics to geriatrics. We need payers who cover costs, right? And we need technology and cutting edge medical equipment and diagnostics. We need a coordinated supply chain. Law and ethics also shapes our healthcare experiences. And my argument in the work that I'll do, and I'm sure we'll talk about a little later, is we must recognize that public health is a key component to our health and well-being, and it needs to be perceived as a key player in the healthcare ecosystem. So we need policies and we need incentives that make these relationships functional, all in the spirit of improving patients' experiences, improving the health of communities, and lowering healthcare costs. Because right now we're spending approximately 2 times more per capita in healthcare when compared to other industrial countries or our peer countries, and our life expectancy is among the lowest. So I'll land the plane now for this question, but in our program, we focus on the ecosystem and all the different players that are involved to make sure that healthcare is timely, to make sure it's safe, to make sure it's efficient and equitable. And so this broad mastery of the ecosystem, it positions our students to have a deeper level of understanding of the barriers that negatively impact people's healthcare experiences. But more importantly, Tysus, they graduate with a skill set to solve complex and seemingly intransigent issues that are rampant in our healthcare delivery system.
Yeah, I mean, that's actually really good because, as you know, my background is, working with just some really passionate and bright individuals on public health. And I guess I didn't, there's so many ways it's all divorced. So I remember when I joined the children's hospital I worked at, and I couldn't believe that there was like MDs with like MPH behind it. And I'm like, gosh, didn't you go to school long enough? But it was what I quickly learned is that public health piece was really missing. Or my one doctor that I worked with, and he had an MBA too, because he had to keep getting degrees in order to fill the picture what it really sounds like of the work that you are doing holistically in your department. So
yeah, we're living in a biomedical system of care, not a biopsychosocial system of care, right? It's
right.
all about sick care and treating illness, right? Mm-hmm. And that's where the money is, right? And so incentives are around making money, and that means taking care of people when they're sick versus prevention. Here's a perfect example of what we mean by bridging that gap between medical care and community. If a patient is food insecure and that patient needs a prescription, and that prescription needs to be taken on a full stomach. And if that patient is food insecure, so we prescribe the prescription, the patient takes the medication on an empty stomach, it causes more damage, and we're not seeing progress, right? And so we need to recognize what the home environment looks like and make sure that we have communities and infrastructures in place for people to have what they need to stay healthy. And so that's just a perfect example of how we need to bridge that gap between medical care and public health or healthcare or community health.
What's really funny is that my mom had like this really vibrant personality, and even by the time she was diagnosed in February, she was just sick. Like she just wasn't feeling good. It was hard, her being her natural self was really diminishing because of the pain. And I've heard that pancreatic cancer is just one of the most painful cancers, but she still coalesced lots of friends during chemo treatments. I would like, it was so amazing. I would see people and I'm like, you know, my mom, like, you know, it was amazing. And one of her best buddies, this was her second fight with cancer. And I, you know, I think about her often because she would call when my mom stopped going and was in hospice. She would call the house and I could just hear her not feeling as well. And I linked this back directly to her daughter and her like 3 children moving in with her. And she was doing really well, but the stress of additional people in the house and kids and everything that came together with that, just like, you know, just really deteriorated like her fight and her ability to fight with cancer. So I don't think people think about what a luxury it is to for people to be able to eliminate some of those barriers, like, you know, food and those other parts. And you know, I think about that in the perspective of my mom, but then there's also barriers that you can't erase, which are the sort of health disparities. You know, I began, you know, talking about with my mother, her misdiagnosis with diabetes. And the only thing I could think about is that they just saw like, they saw a, you know, a Black woman and said, oh, you know, this symptoms, it looks like diabetes. And so it must be diabetes. And it just made, you know, it just, that's where I think I was really angry, because I really felt like the health disparities and the inequity that comes along with those inequity piece just came in and just, you know, robbed us of the ability of having more time to fight the cancer. And one thing I didn't do, and I was quite intentional because I wanted to do it in the podcast, is to really, if you could, and this is, this, I know I could do this because you're, you know, the professor hat and this is research, but if you can really define what health disparities mean. I know there's been a movement towards health inequity or equity. If you could sort of define that a little bit more, I think
I'm happy to do that. So in very simple terms, health disparities, these are measurable differences in population. So if you take one particular group of people and another group of people, and you're looking at mortality, morbidity, and you see that there are measurable differences in who's getting sicker and who's dying earlier, that is a disparity, right? The question is, why do these disparities exist in the first place? That is because of inequities. That is when you have a system in which some people do not have the same level of access to opportunity as others, right? And I'm not talking about health right now. I'm talking about the basics like education, jobs with livable wages, food, access to affordable, healthy food. When you have one population that has more access to that than another, you're going to see measurable differences in those two populations.
Mm-hmm. That was perfect. That was really clear and concise. I deliberately separated rural health out. And sometimes you can kind of bring that into the disparities part, but I wanted to separate it because it's its own big monster in itself. And I know that, you know, where you practice in DC and we're in DC and we're very urban, very, very urban. But one thing that I've always noticed since I've sort of moved in this space of doing fundraising in healthcare is I saw so many similarities between urban and rural, like this health and the disparities. It was interesting, the similarities, but in a state like Georgia, where my mom resided, and my family, they were in a rural area. But, you know, when you think about Georgia, you automatically think about Atlanta. But the biggest part that kind of brings in like the similarities is in Georgia is that they are not a Medicaid expansion state. And there's 12 of them, which is like almost 4 million people. that, could benefit from a different healthcare system. So I just wanted to talk about, as we were talking about like disparities and inequities, is, as we look across the landscape of the United States and what happens in this healthcare system, where do you think some of the greatest opportunities lie, that could start to move us away from like sick care, or I'm really open because I really just am looking for your expertise, because I think there's a lot of opportunities, and but it just feels like there's so much, it's so big, and it's so much happening that affects so many people. But if you could just kind of highlight, as you're teaching, and you're thinking about, what are some of the opportunities to shrink down some of these disparities, where do you think they exist? I'm sorry, that's really
So,
big.
no, it's fine. So I think it's also important to delineate health disparities from health care disparities. So
Oh,
your mother experienced a health care disparity. These are things that happen within the walls of the medical institution, where you have
exactly.
some population getting a different type of treatment than others. And then there's health disparities. And I think that's your question, right? It's more broad. Like, what is it that we need to do at a macro level to
Yes.
make a difference, right? And
Right.
so we know that the majority of our health is shaped by where we live, learn, eat, and play, not by the quality of the medical institution, right?
Hmm.
And for so long, we've always relied on the healthcare institution, or the sector, the healthcare sector, to address these issues and eliminate or mitigate disparities. Well, they play a role. The healthcare plays a role, but if we really want to put a dent in the issue, we have to improve the conditions of communities in which we live, right?
Yeah.
So that it's easy for people to make healthy choices, right? So if I'm driving in a neighborhood and there's McDonald's and Wendy's, and I'm not disparaging and bashing, because you can choose healthy food products in those establishments as well. But if there's a lot of places that I could go for food that's affordable, that's not healthy, I'm going to be more likely to make some poor choices, right?
Hmm.
We shouldn't have soda machines. I'll talk to you about my mother, but I was with her in the hospital, and I was thirsty, and I went to a vending machine, and this was in a hospital. The only thing that I could see were Mountain Dew and Pepsi and all those things we tell people not to eat and drink when they're sick, or even when they're healthy. Um,
Yeah.
but guess what I did, because I was thirsty? I got a Mountain Dew.
You're
'Cause
probably tired too.
I was tired, and I was like, I just need something. I need something, so I got the Mountain Dew. But if there was something healthier, I would have chosen that. But that's my example. It's like, how do we create communities that make it easy for people to make healthy choices? Because I think we because of the American way, we think about personal choice, and you get what you deserve because you made a bad decision. And I'm on the opposite side of that. I'm like, well, let's think about the system in which we're operating that pushes people in conditions and to make decisions that aren't going to be the best for them or their families or their communities, right? And so how do we do that, right? And so I always say, first of all, who are we putting in office, right? Are we asking these policymakers the right questions, or those who aspire to influence policy? We need to be sure we have folks in office that really get it, and they understand that if we want to improve health, we can't just look at hospitals and health systems.
Right. Right.
And there needs to be a narrative around that in every community. And so that would be my recommendation, is to look at who we're putting in office, and we need to use our voices to advocate for high quality education. We're in DC, and I was just watching the news, and I know that there's some libraries that don't have librarians. And so there's a push
Yes.
for every school to have a librarian. And I'm like, wow, this is where we
Mhm.
are in a nation's capital, you know? And then we wonder why our students may not be achieving like other students are in other parts of the region. So we need to also advocate for, making sure we have access to high quality foods in Ward 7 and Ward 8. The last time I checked, there's 3 full service grocery stores to accommodate 148,000 people. compared to Ward 3, where there's 9 grocery stores to accommodate 80,000 people. That's a disparity, measurable, right?
Yeah.
It's measurable. And so we wonder why people who live in Ward 7, Ward 8, may not have the best outcomes or do not have the same level of outcomes as folks in other parts of the city. And it's because of the conditions in which we're living, learning, eating, and playing, which over time will impact our health status.
And it's so interesting you say that. I love those pieces because one of the things I was trying, as you were talking, I was like trying not to get emotional in the sense of my mom, was asking me some questions like, why did I get pancreatic cancer? Like, what was it? And one thing we know with cancer, it's a multitude of things. It could have been environmental, it could have been the food shade. It's a multitude of issues. But I do know that the type of pancreatic cancer she had, it wasn't genetic. And so, I one of the first things I saw is that pancreatic cancer is that African Americans are, this is a health disparity for pancreatic cancer, because this is good. That's why I'm like, yay, I love a professor here. And I'm like, is that African Americans are diagnosed at a later stage. And one of the tricky part about pancreatic cancer is the fact that you just can't do like a blood test and they're oh gosh, this is such a good tie back. There actually is new legislation for funding to do new ways to test for pancreatic cancer, which is really important. And so I hope to advocate in that sense for that to happen as well, because what we know is that African Americans are diagnosed at later stages for pancreatic cancer, which puts them at a stronger likelihood to pass away, and that's why their rates are higher. And not
because they're Black, right? It's not a racial issue, right? It's not because I'm a Black man that I'm more likely to. Because I'm a Black man, I'm probably going to it'll probably be detected later. And then we have to ask ourselves the question, why is that? Right? Yes. Why is that?
That's so good. Sorry. I'm like, yes, that was a great clarification. And so, I have like my mother, this goes back to the conversation about rural health, is my mother was seeing a physician's assistant because there just wasn't enough primary care doctors where they lived. And so I felt uncomfortable with that. And it's not anything disparaging about physician assistants. It was mainly because my mom had her age and the type of her health and where it was at. I was like, maybe you just need someone, that's going to keep a closer track of you. But the concern is that they had such a high patient overload. And one of the things, my mom was really good about complaining, going to the doctor. And so she actually, before her misdiagnosis, had been talking to her physician assistant and talking about some pain and some other things she wasn't feeling like herself 4 months ahead of that. And so I say all that in the couple of, there are pieces of, in the environmental part and in the healthcare that is sort of out. It wasn't, like you said, wasn't necessarily the care that wasn't caught. It was sort of this big system of there's not enough family doctors. You see someone for 15 minutes, or the type of insurance she had didn't allow them to test unless there were certain types of systems. Right. And right. So it was, even when I talk about our discussion today, it's not just about the care. It's the care is not the overriding piece that I feel. And so it's just, so that's why I started with big questions. I was like, we've got to figure this out. And particularly talking about like conscious giving, and being intentional with our giving. And so this year, we're really trying to wrap our arms around the way that you conscious give your time, talent, treasure. and to kind of create more equity. And so I just wanted, because it really dovetailed as you talked about these two big issues. If I'm in my local community, and we can use DC for example, since we're both in DC, what would you say to Tice is a way that you can conscious give? Because now, I'm really passionate about what's happening, and I just don't want to go and say, I really love the work that PanCAN does, the Pancreatic Cancer Foundation, but I'm really, really trying to say, I just want to see more equity. I want to see people. I want to shrink some of those disparities. What would you say? Going back to, what would you say with that could really make a difference for someone, like an individual who wants to do conscious giving, to grab hold of?
So I hope I answer the question. If I'm off, just please let me know. But I think that if long term, right,
Mhm.
there's a lot that we're not going to be able to fix in our lifetime. We can do as much as we can while we're here, and that's what you're doing. That's what I'm doing. I'm so blessed to do this work. But I think that if we really want to put a dent in help inequity, right, and make sure that all people can achieve a high quality, have access to the services that they deserve at the right time and right place and so forth, and are able to lead healthy, meaningful lives. We need to start with making sure that every child has access to a high quality education. The evidence is clear, right? Education is strongly correlated with health outcomes. The higher educated a person is, the more likely, statistically,
Mhm.
they are when it comes that they're going to be healthier people throughout all stages of their lives. So that's one recommendation, and then the other is again just making sure we're using our voices, our time, our resources, uh, to advocate for conditions that allow people to live healthy lives. Um, it's all about, again, the communities in which we live, and how can, I think about my own community. What can I do? And I do it, can I do in my community to be sure that we are not only do we have access to resources, but are we connecting as people, as neighbors, right?
Mm.
Because this loss of community really has, I think, played a role in people's choices and their well-being. We have to also talk about behavioral health and mental health and the role
Mhm.
that plays in our wellness and inequity, right? And so, just being sure that we are creating communities that are nurturing, and loving and supporting, and that makes a big difference. So yeah, just using our voice, our resources, our time to just advocate for conditions that just make this life that we live just a little more pleasurable and
Yeah, yeah.
meaningful, right?
Mhm.
Meaningful.
There's one I want to get to, some of our personal conversation that we had, but before we go there, were so helpful to me, um, with recommending some organizations that are doing great work. And this year in the Conscious Giving Guide, we're really honing in on three organizations. One you recommended, I was just blown away, because just the personal experience of my mother, but also being, at a oncology center where I will never stop talking about. It was a young man who rode his bike to his treatments, which is really overwhelming. I was
Yeah.
like, what's going on, and his appointments. I saw so much in that span that, I wasn't there. My mom, those 5 months that she was being treated. But you recommended some organizations that I would just love for you to highlight, cancer support systems that's in the Conscious Giving Guide, but a few others. And could you talk about those a little bit?
Yeah, so cancer support community is a wonderful, wonderful resource for persons who are experiencing cancer wherever they are on the continuum, right? From early diagnosis all the way to survivorship, to end of life, if that's the case. And so, I mean, they are your advocates, and it's very user friendly. Go to the website, cancersupportcommunity.org, and they work with you. They work with patients and family members. It's not just about, because they realize the important role of caregivers, and they have a very, very holistic model. But it's access to services in real time and connections. And I am affiliated with their work just as a volunteer, and I've been very pleased, and I would recommend them for anyone who's interested in supporting the cause. The other is Food and Friends, which is based here in DC. Food and Friends provides medically tailored meals to patients who are homebound. And so these are customized meals based on people's conditions. So people living with diabetes, and notice I'm saying persons with and not diabetic patients or diabetes, you know, that's one thing we teach our students is person first language, persons experiencing homelessness, persons living with cancer. So they provide medically tailored meals. They deliver these meals to people's homes. And the thing that I'm working with them on is, you know, they're not perceived as a player in the healthcare system, you know, so they're not getting reimbursed for their services. But we know that these services are making a difference in people's lives. We know that these services are preventing readmissions. We know that these services are lowering healthcare costs, but they depend on philanthropy, right, to pay the bills and do the remarkable work that they're doing. And so that's a perfect example of how we need to change the reimbursement model, the payer model, to be sure that organizations like Food and Friends can be sustainable and fiscally viable and continue to do this very, very important work. And I think I gave it 3, or did I give you just those 2?
It was one more.
Oh, no, was it Bread for the City?
Bread for the City.
Okay, so Bread for the City is a federally qualified health center. It's an FQHC based in DC, and they provide primary care and specialty care and behavioral health services and all kinds of wonderful services for people who either are uninsured or underinsured. And because they are an FQHC, that they use a sliding fee scale, and if you can't pay, you still get served. And there are several FQHCs, but especially acknowledging Bread for the City because they've done some interesting work around addressing systemic racism as a root cause of racial differences in health outcomes. They've been very, very, they've been a mover and shaker in the space for quite some time. And I have mad respect for the work that they're doing.
That's really cool. So we actually, in the Giving Guide, we have a FQHC that is local to the county that my mom was served, you know, her health service was Liberty County. And so they serve Liberty as well as Long counties in Georgia, in South Georgia. And so it's Diversity Healthcare. And what's really interesting about them is that I you know, they have a new building that's right next to like their old building, so you can sort of see the difference. And when my family first moved there, I remember looking at the new building, saying, "Oh, look at the Affordable Care Act building," and you know, because there were, I know the impact that the Affordable Care Act had on so many FQHCs was just amazing. And so you mentioned this with Bread for the City as a specific organization. So I even hope people who are listening today will even look at their work, or, you know, FQH, other FQHCs, because we're in South Georgia. There's a large African American population, a really growing Hispanic population. They have farms, and so they have a lot of migrant workers, which this is the only place they can get care, right? There's no health insurance for undocumented persons in Georgia or that area. So they really play a critical role in the community. And so there was a lot of change with the Affordable Care Act. And I didn't plan on this, but when you mentioned the FQHC, I just thought to have a moment to really shape some of what FQHCs do, because particularly in a number of communities that are rural, they play such a critical role for that primary care. Or if DC is a little different, right? We're on, we have a really high number. Is it 96%?
96%. 96%.
Individuals that are insured, but they play a critical role in a number of states where they don't have the advantage of having at least an insured, high insured rate.
And even though 96%, and this is interesting because we released a report in 2016 and we were telling folks we are one of the out of all cities and states, we are among the highest when it comes to insured rates. And I would have very intelligent people ask me, well, why do we have all this sickness? Why do these disparities exist? Yeah. So again, and that's what I talk to my students about. Just because you have an insurance card does not mean you're going to get the right care at the right time and in the right place. And that's a whole nother talk show for us.
Right care, right time, right place.
In the right place, right? Right. Okay.
That was really good.
So FQHC is interesting you bring that up, because that's where I was trained. I was trained at an FQHC in Southern Maryland, Greater Bay Medical Services. And that's where I really started to connect the dots, right? And we were actually, one of the first grants I wrote was a bicultural demonstration grant, because we had a lot of migrant seasonal farm workers in that part of the state. And that population was growing. We were in FQHC. This is the place that folks go who are undocumented, and we wanted folks to be okay with that. We realized that there was still a distrust issue, right? And so we saw there were a lot of folks coming into the community in that part of the state at that time, but they were not coming in for care. And so guess what we did? We had one patient who was the owner of a Mexican grocery store, well respected in the community. And we partnered with him, and he let us set up shop in his grocery store, right? And he was the one that promoted our services. It wasn't us, it was him as a patient promoting our services, helping us facilitate transportation for the undocumented population and others who just didn't think that we were a safe place for care, or a place that was not very culturally sensitive to people's needs. And that was work that we were doing. But through that partnership, we were able to increase the number of persons who spoke Spanish as a primary language in the care that we provided. And that was success to us, right? And so I share this story because it's important that we partner with the community and recognize we don't always know the answer as healthcare professionals, as doctors. With all the alphabets behind our name, we need to humble ourselves and realize that the more we learn, the more we realize we don't know. And we have to have those types of interactions with our patients. Patients are tired of the omnipotent, I'm a doctor mentality. I think that if we continue to operate like that, we will not see significant improvements when it comes to addressing the mistrust or distrust issues that people have with providers. And so that humbling ourselves, partnering with community members and letting them drive the change in the intervention is a key competency. And that's what we talk about in our program. We talk about what does community engagement really look like, and where have we missed the mark, right? How do we use ourselves as the folks in the back, the back burner, right? And the folks who are actually leaders in communities driving the change, because that's what it takes. And that's what the community help, what I learned at Greater Dayton. But yeah, they provide primary care, specialty care, dental, transportation services. They have a very holistic model, and they don't turn anyone away. And so anyone with a pulse can go to an FQHC and be served.
Yeah. And we had, when I was growing up, we knew that it was Matthew 25 and which I realize there's a lot of Matthew 25s. But back in the 80s and 90s, it was a whole, it was very different. And I just remember even family members and what Matthew 25 meant, and they would be open on certain days and long waits. And that was the people still kind of hold those perceptions that but I wanted to touch on FQHCs because there's just such a critical role that they're playing in healthcare, and the I guess it's sort of like in this dignity space. So if not having insurance, you just do what you have to do, but it wasn't a lot of dignity being in line with kids. I remember my mom was laid off one time and we didn't have health insurance, and my sister needed her school physical. And I remember, I'll never forget, I was a little, I don't even know how old, 6 or 7, but I remember being in line because it wasn't a priority we were there like all evening, like I don't know how many hours, but I just never forgot that. So coming into DC and looking at like these amazing spaces and care, and it was really something that I was so impressed by, because I believe that exactly what you just demonstrated, that when people come in and they feel like this is it's not just the physical care, they care about you as a person, and you're being heard from the time you get through the door until you're leaving. It really is so important. And so it's just really, that just really shaped a lot for me about thinking about like the role that we have on every level of care with the programs. I wanted to sort of shift to this because I feel I didn't really realize until we started, but I feel very emotional about everything. My mom she just passed September 11th, so I didn't realize like how emotional everything would be. So excuse me.
It's okay.
And it's really coming from like a place of gratitude, because I'm learning too, like as we're talking, but it's just such a wonderful experience. So one of the other pieces that immediately I was like, oh, I just feel so blessed to have you participate in the Giving Guide this year, is that you shared that your mother had cancer, and you had similar to me, the opportunity to do conscious giving every single day with her. And I didn't want to really frame any questions. I just wanted for you to share in terms of being a health professional. And I don't know if at the time, I didn't actually say, but you were in leadership at one of the largest, health systems in DC and Maryland. So a really large system that shapes the health and healthcare outcomes here, and you did amazing work. But how, if you could share a little bit about coming from the perspective as someone who thinks about, health systems, healthcare every single day, and then it really hits you from the personal level. I think that would be, because I hear it in, now the work you're doing and how it blends the personal and professional.
My goodness. Oh gosh. Again, with all the training I have and all the work that I do, you just don't realize how complicated it is until you're in the situation. And I was in the situation with the person on this earth that I cherish most. That's my mom. And so, you just realize, wow, the system is really, really broken. And my takeaway, Tyson, is most people really want to do the right thing. The doctors, the nurses, people really want to do the right thing. But again, they're operating in a very complicated system, and the incentives aren't aligned with what we want to see. And so I had to always step back and think, these folks are really doing, because there were many times that I caught issues right? Because I'm on top of my mother's health. I'm going to see her in just a few minutes when we're done. But I am on top of her, and there have been so many times that the ball could have been dropped and hit the floor, but I caught it, right? And then I had to step back because I would immediately want to blame people, you know.
Yeah.
And most of the time it was just the system in which we're operating. Fax machines, it's a perfect example. I can't tell you how many times a fax didn't get to a provider, and no one knows where it is, you know.
Wait, I realized that I didn't think anyone used fax machines until this year.
Hello?
And I realized that fax machines are still like critical in 2021.
Yes, it's the healthcare sector that's keeping the fax machine manufacturers in business.
Exactly.
And I, you know, if I didn't call the provider to say, did you get the fax? Something wouldn't have been done. It's that simple, right?
Yeah.
And so again, was that a bad person that were these people bad actors? No, they're operating in an archaic system. And so having that knowledge and just stepping back, that really helped me manage my emotions and how I interacted with many members of the care team. But it is a very, very complicated, and my mother had cancer, right? So very complicated, all these different players, again, systems thinking, all these different players have to work together for her best health outcomes. And so as her caretaker and overseer of her care, I found myself being the one to make all those connections happen and stay functional, which was, and continues to be like another job, you know?
Right.
Yeah, it's like another job, but I know that I am, and I don't want to sound pompous when I say this, but I think that I am in the best position to do this for my mom, given my experiences, my education, my networks, because I know people in the healthcare sector. I'm blessed. My mother is blessed because of those connections. But I always think about people who do not have a Christopher, someone to be an advocate for them. And it breaks my heart because I know how easy it is to fall through the cracks. I've seen it happen almost with my mom, but also with people that she'd become friends with in her care that are no longer with us, you know? So it's been tough. But your mom sounds like my mom. She's a light, inspiring all kinds of people. I mean, I call her supernatural. You know, she's still in a skilled nursing facility, still recovering from the side effects of the radiation. She has a feeding tube, she has a trach, but she is the brightest patient in the building, you know, and she's remarkable. I mean, people need to really talk to her and help understand what is it about her that makes her so unique, and to be able to go through so much pain. I've seen her go through so much pain, and a few minutes later, she's laughing and dancing. You know,
I love it.
I'm just like, who are you? If I have just 1% of what she has, I think I'll be okay in this life.
Yeah,
you know?
and I know.
Sounds like you have a similar narrative.
You know, we had a memorial service, and my sister talked about like when she was like preteen, 13, 12, and my mom actually gave a hitchhiker a ride. And this is a different time, but we were laughing because my sister was like, that was the example she's carried with her, is that if my mom would do something that crazy, she is all, you know, nothing can measure up saying, oh, we should give him a ride. I feel so bad for him. Yeah. But it was, you know, she was always wanting to help others. Like, you know, just, you know, I remember one of her second to last treatment, the nurse called me and said, your mom's having me call you because she wants to treat us all to Arby's.
Yeah.
They had root beer floats this summer, and she wanted to treat all the like everyone in the office.
I believe
you know, and just like we know our mom, we're like, oh, no, 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 don't worry about it. Not a problem. Nope, you're not paying us. We're not getting in trouble with my mom. Like, there,
Mhm.
I was like, just tell me the order and I will get it, before I pick her up. But I mean, even in the midst of like just so much pain and so much happening, she
Yeah,
was always trying to figure out what she could do for someone else, and
yeah,
that was so great. And she had the best. Her oncology office was amazing. Her physician, her oncologist was absolutely amazing, and it allowed her to be herself in that
yeah,
environment. So that was actually great. And we actually talked about this. My initial thought is I was thinking about, well, maybe I should bring her to DC because the care,
yeah,
and this goes back to something you spoke about earlier. I was like, well, it's more sophisticated systems. I'm not really sure. And within 5 days of diagnosis, I'm down there in Georgia. And I knew, just in terms of, my mother lived with my sister, her husband, and two girls. It was home, and I knew she would do better in that environment.
yeah,
And we were really fortunate. They had just opened a few months before a new oncology system center, like 6 minutes from the house. And so it made a really, really huge difference, in terms of us being there and her being in her own bed and with the dog.
yeah.
with the
With the dog,
dog.
with the dog.
So important, the dog.
Yeah,
um it's such a, I wanted to sort of conclude with just talking about your mother, not even knowing what just a bright light that she is. And I know that, I although do have to say, just informally, I knew your work, and so I know what great work and passion that it plays into, and underscoring passion around these ways. And conscious giving, when we talk about passion, it's intentional. So it's not just like, oh, it's great. It's actually intentional. And I see your work as passionate in intention, and how you approach your professional work. So that was really, I think, one of the pieces when I listened to you today, is thinking about that, without even saying it. I'm just like, sometimes we forget that conscious giving also can be in our professional work. It's not the board sometimes you sit in, or what you donated. I hear it. I hear it in your work, and how you're in, the research and the students and community.
yeah.
Is so much that you're giving back. So I really want to thank you for that, as a person who's benefiting in the
Thank you.
community.
Thank you.
So just that really just makes me feel fortunate that you're in the position that you're in. So thank you
Thank you.
so much
Thank you. Thank
for
you for
being
having
here
me.
today, and sharing not only your professional work, but a little bit about your mom. And it's gonna keep me smiling just thinking about how resilient she's been
Yeah.
through the whole process, because I know that cancer is really tough. Is there any, in terms of, I know that you're active on LinkedIn when you have an opportunity, not busy, but is there anything else, any of your other work, or that you're doing, if people want to learn more, or read more about some of the research that you've done? I know that I know you're always doing something in DC. So I can
Yeah.
say there's a lot
Yeah.
of your fingerprint is all over a number of work here in
Yeah,
DC.
I think the best way, Tysus, is you could just Google my name in Georgetown and my bio. My bio has my publications listed there. I'm really excited. I'll take, if it's okay, just 10, 15 seconds to talk to you
No,
about
no.
something I'm really excited about that will be released in February. So I've talked in my work a lot about disparities in DC and, these measurable differences. But I can't say the name of the journal right now, but I got a call from the editor of one of the nation's top journals. It really wanted me and a few colleagues to write about the history of our nation's capital, and how the history has put us where we are today. And
Mm.
so it's going to be a very unique piece, a gift, I think, to the city, another tool to put in our toolkit around advocating for DC statehood. And it's going to shed a different kind of light on disparities and inequities in the District of Columbia. So I'll be sure that to push that out to you, and you can share it with your network. But it's an exercise that I think every city and community needs to do if it's serious about addressing systemic racism as a root cause of racial differences in health outcomes.
I'm excited. As someone, I've been in DC now for 13 years, and I've asked a lot of questions. Even prior to moving DC, you ask the questions of why does DC, Washington football team hate the Cowboys so much? It's just those are one of the questions you ask. You ask a question about the impact that Marion Barry had on the community. Like, what's the love with Marion Barry? So those were things I remember.
The crack epidemic, and
exactly. You got to go through, and you're trying to decipher, and so my generation, people who are my age, were in growing up through DC during the crack epidemic. And so people that I've made as friends has really shared their own personal stories that has helped me to understand our neighborhoods. People and what they do, and even for me, understanding when you talked about even the number of grocery stores and how people migrated and got to different communities.
We talk about that. We have the whole timeline plotted out.
Oh my gosh. So I know that was a huge undertaking.
It was major. I'm so glad it's done.
Well, I can't wait till February. So I certainly will share it, because a part of the Conscious Giving Guide is just a few pieces that people can learn more. And so I want to continue, as people are thinking about health inequities and the impact they can make with conscious giving. So that was excellent. So thank you so much for sharing that work too. Thank you so much for being a part of the Conscious Giving Guide 2021 and joining the podcast and the vlog. So it'll be everywhere. It'll be everywhere.
Awesome.
But thank you so much, Dr. King.
Thank you.
I hope that the rest of your year is amazing. And you said you were seeing your mom later today.
I'm headed out just as soon as we finish.
I'm hoping there's some little dancing. Take a little piece of music for her, because I think it's a day to kind of.
Anything Michael Jackson, she's good.
Oh, I love it.
All right.
Thank you so much.
Okay, bye-bye.